We've been talking about the cost of healthcare in this country in the wrong way. If we think about our household budgets, we can't afford not to have Medicare for all. We're the only developed nation on earth where the average family with insurance pays more for healthcare than it does for groceries. That's because having coverage, quote unquote, is not the same thing as having healthcare. When you have private health insurance, it means that sometimes, if the insurance company executives give you permission, insurance will pay part of your healthcare costs, but only part of it. Even if you have coverage from your job, which makes you one of the lucky ones in this country, chances are you're paying way more for healthcare than you even realize. After all, there's premium deductions in your paycheck, there are co-pays and deductibles when you get treatment or medicine, and there are all the things your insurance probably doesn't cover, like vision, dental, or hearing. Now, experts say that the average family of four with good quote-unquote employer-based health insurance will pay more than $12,000 out of pocket this year for health care. Average household income in this country is about $57,000 a year. So that means the cost of health care is like an invisible tax of over 20% every year on middle-class families. When you add in what employers are also paying, money that might otherwise go into our paychecks, our typical family's healthcare cost is about $30,000 a year. Now, about 80% of Americans live paycheck to paycheck, according to studies. Roughly half of us say we'd be unable to cover a $400 emergency expense. That means that medical costs can literally be unbearable for most Americans. A lot of people go without the care they need because they can't afford it, even when they have health insurance. When that happens, we pay even more in lost income when we can't work, in pain and suffering and disability, and in the burden we may become on our families. Sometimes we even pay with our lives. And families aren't the only ones paying for our broken healthcare system. Our entire economy suffers. Our national healthcare costs keep on rising. We pay more than any other developed country for healthcare, even though we get far less for our money than other countries do. Now, Medicare for All takes the same great system seniors have today, makes it even better, and then makes it available to everyone. Middle-class families will pay far less than they do today, and they'll get much better care. Doctors and patients, not rich health executives, will make health decisions. People won't have to go without the care they need. Our economy will be better off, and we'll be doing the right thing for everyone.